Zaato as well. Yeah. He was shaking his head in disagreement on a number of things that I think people you were saying. Dr. Zaato, why exactly is the point of departure? And
once again, good morning to you and good morning to your listeners all over the country. Seriously, I wish I was also in the studio to say with Martin so that we can do justice to some of these issues. I want to start by thanking the nurses and the GRNA. They have proved that they are patriots. They have proved that they love their country. And they have proved that they will put the welfare of the country at heart. By temporarily suspending and going back to work, they have won my heart. And I will continue to cheer for them. You are ordinary workers. You are not looking for riches. You are just looking for what is due you. You are ordinary men on the streets, and you are the first line of defense when it comes to our healthcare. I want to thank you for the good work you are doing, and I pray that when you go back, you continue to be as professional as you are. Thank you very much for your sacrifices and for your dedication to Mother Ghana. 2, I also want to talk about the politics of this whole history. The government of the Republic of Ghana chose politics and rhetoric when it should have been working. And what we have seen is an amateur hour on the part of the men and women in government whom we elected to take off this critical and important issue. When nurses were asking important questions and deserving rightful answers, what we saw was political theater, what we saw was amateur, and what we saw was an insensitivity to these important issues. This is one of the biggest, if not the first, test for the Minister of Health, and he bombed. This is one of the first, if not the biggest, test for the Minister of Labor, and he bombed. They dropped the ball. First, around last week, 2 major unions came out making demands. One of them was my own union, UTAC and others, gave government ultimatum. And then there was the Ghana Registered Nurses Association. The Minister of Finance met UTAC and the others and assured UTAC that yes, what you want, you will get it. What you want is in the budget. We budgeted for it for you. So no problem. Just go back to your campuses, chill, have fun. The money will come. That was the government did not negotiate the UTAC package. No, they inherited it from the previous administration. But because they love UTAC, because they respect UTAC, or because they fear UTAC, or because of the political power of UTAC, it found its way in the budget. The nurses negotiated in January. And that's what I'm saying. By January, the previous government was not vulnerable. It wasn't 2 days. It wasn't like the strike that Labour had or they threatened. Just 2 days to the elections. When I say 2 days, I actually meant 3 months or 2 months. No, this negotiation ended in January, February, March. That is in the first quarter. So who creates physical space? So if you are not saying there is no physical space in the budget, listen, physical space is not a natural occurring thing. A man, a woman, people sit down to create a physical space. Why did they not create a physical space? How did you create physical space for UTAC, but did not create physical space for nurses? Somebody did not do it. It was deliberate. It wasn't accidental. So if you don't do it, and if you refuse to create a physical space, now don't tell us that the economic conditions, that if you implement this, it will throw government finances into jail. When they read the budget, there was nothing like D-levy. Government did not think that it was important to put a levy on fuel. But something happened. Government physical space changed. Something happened. Government finances changed. So in the midnight stroke of an hour, through an emergency, D-levy has been implemented. It's going to take effect. So if you did not put this in the budget, but the last minute you realize that it was important, what also prevents the government from bringing another levy, emergency levy, to take care of this? The fact that you brought that emergency levy to deal with the critical financial situation facing ECG means that you can also create that same financial space to deal with the nurses. Not doing it is a matter of choice. It's a matter of prioritization. You prioritize ECG over the nurses. That is a choice every government makes. So to say that there was no fiscal space is neither here nor there. 3, you are saying that the amount that the nurses are asking for is too much. It's 2 billion. Okay, let's even agree. And you said you cannot provide the 2 million. Again, 2 billion. Again, let's agree with that. So how much can you provide? 1.5 billion? 1 billion? 500 million? How much can you give them? Somebody came to you to say that we have a deal, and you acknowledge the deal. But you are saying that after we acknowledge the deal, I went to sleep. I forgot about you. I ignored you. So the nurses should suffer for the incompetences of the men and women who were supposed to implement the deal. How do you even justify that? What is the logic behind that? The nurses held their part of the bargain. Somebody in the government did not hold his or her part. And now you're saying nurses suffer because of somebody else's incompetence. Who does that? Look, I think that we need to be serious as a country and need to do this. If you wanted a budget space, because I just heard the representative of the people talk, look, they met this government so many times before the strike. They met the government during the transition. I heard them say that. They met the government when the new Minister of Health came in. They met them. They kept meeting them. When you were meeting them, what were you telling? What were you offering the nurses? They met you before the budget. What were you offering them? You see, we keep doing these things to ourselves. There's a note here from the president of the GRNA, and I quote, if they are telling us today that there is no room within the budget to cater for what we deserve as nurses and midwives, then they are telling us that they do not value what we do in the health space. And that sums it up. It's not about, look, this is not about the lack of money. No. This is not about the fact that there's no money in the budget. No. If you believe that those are very simple and lazy arguments. No. This is about value. Do you value the work that the nurses are doing? And are you prepared to put your money where your health is? If you value them like you value UTAC, you will cut it for their benefits. If you value them like you value other unions, you will do that. But if you choose political propaganda, if you choose political amateurism, if you choose political theater over substantive issues about people's health, this is where it lands you. So again, I am happy and I'm glad that these patriots have chosen to go back to the works. I'm glad that they have done that. So please, somebody tell the political machinery that no, it's time they to sit down, tighten their belts. There's a mid-year review coming, and tell us what you can do. I'm glad they are saying that they're not taking it. They are just, listen, these are just ordinary, normal workers who just deserve what belongs to them. Government should not afford to hide under legalities, to hide under technicalities, to try to vary it to the disadvantage of these people. Prioritize their health care. You didn't include it in their budget. They didn't do that. You didn't prioritize it. They didn't do that. They should not suffer because you are insensitive to their needs. No, they should not.
The point you made earlier about government coming to the table, also how much it can give, because already a cost has been put to the implementation of this collective agreement in its current form. The Deputy Finance Minister this week put it at 2 billion cedis if it has to be implemented in its current form. So the proposal you make when you were talking is that if government is able to come up with $1 billion or 500 million, they should come to the table with that. That's renegotiation. But that's the position the nurses don't. They say it's not up for discussion on the table.
Exactly, and I agree with them.
Why is that?
What I'm saying is that if you are saying you cannot give us 2 billion, what can you give? Just tell the public, because we are public. We are consuming that information so that we can know what we are working with. I'm not saying negotiate again. I'm just saying that your only argument cannot be that it's not in the budget and we cannot afford. That's lazy. That's simple. Again, especially since you had time to put in the budget. Why didn't you put it there? That's your incompetence. That's your negligence. That's your insensitivity. The nurses should not carry that burden. And all I'm saying is that at least as ordinary citizens, we can engage in an adult engagement or an adult conversation that says that, okay, we've just come in, we've seen this in the budget, but doing our maths, it doesn't add up. So instead of the 2 billion, we think that we can give you 1 billion for the first half of the year, then we'll add the other billion in the second quarter. I'm saying that that is a more matured and a more sophisticated argument. The nurses could then say, okay, let's do that. But right now, it's like you are not putting anything on the table. You are simply saying that go back empty-handed, go back to your people with nothing, and just keep doing what you are doing. That's where I'm coming from. I'm saying that if you want a compromise, then put something substantive on the table for the nurses, if they agree. But it seems the only thing you are putting on the table is rhetoric. The only thing you are putting on the table is propaganda, and that is not fair. So I'm not saying you should negotiate.
Last year, when your people were in government, you said first quarter, approved in first quarter. Why didn't they implement part? Because they approved it before the mid-year budget review. So if you really meant it in good faith to better the conditions of the nurses, you had an opportunity in June or July last year when the finance minister did the mid-year budget review. You should have started from that place. It appears you are giving different standards. You had a mid-year budget review, June or July last year. Why didn't you start? You waited and now your government is out of power and you are blaming this current government, saying it's a lazy man's approach. If you were that thoughtful and very, very committed to upping their conditions, you should have included in the mid-year budget. I think this one is like smoking mirrors. Yes, because now your people are out of office, you are climbing the moral high horse. I don't think there is much integrity in what you're saying. There isn't much. No.
I see.
Thank you, Martin. I'm glad you've come at me like that. But remember, when you say my government is your government, it was the government of Ghana. I wasn't a member of that government.
No, but you are
I wasn't in that government.
You know what I mean?
No.
You are MPP.
Martin, let me answer Martin. I wasn't in that government.
No, but you are MPP. That's the point I'm making.
I wasn't a member of that government.
But you are MPP.
Okay, let's make progress.
Even if your argument is that again, the nurses are there. There's nobody better to make their case than they themselves. And there's one of them probably sitting in the studio with you. You can ask him those questions, not me. They didn't do what they did.
You are saying this government is lazy, and I'm showing you that the MPP of which you are a member had an opportunity.
All right.
I know that you are trying to make the case. I know that you are trying to make the case for the NDC. You are struggling to please the NDC. That's what but let me then make this case. All I'm saying is it's the GRN. No, Martin, you are trying to cloak yourself as an independent. No, you are a mouthpiece of the NDC, and you are there to make your case. I understand that. Make your case. You are not a neutral and objective person. You are there singing for the hymn book of the NDC. Let's put that point to clear. And stop this.
So far, you're not be able to admit that you are an MPP member.
Hold on. Ghana Registered Nurses Association have come to the table. They have said that we negotiated something with government. If they chose or didn't choose to go to a strike last year, that is their problem. I am not one of them. I cannot say, why didn't you go for a strike this year? If they chose to not to go to strike last quarter, whatever they do, that's their problem. They have said now is the time they are going on strike. I don't know what is in the agreement they had with government, but they are saying that the agreement right today, they are coming to call for what is due them. And what they are saying is that you cannot now tell them that it's not in the budget. Government is a continuous thing. Governance is a continuous thing. And there's something in the first thing in the agenda setting is what we call in public policy making agenda setting. The budget of the government is a public policy.
That's you're saying government is a continuous. When the MPP came, you know how many projects they left despite the constitutional provisions in the directive principles. You know how many projects they abandoned, and what was your position when the MPP abandoned a lot of the NDC projects? What was your position? What did you say?
My position is that workers deserve to be treated better. My position is that workers deserve to put better. My position is that you cannot sit there and pretend that you are objective for neutral when you are speaking for the of the NDC. No, you can't do that, Martin. You cannot.
Okay, the point you make about the why the nurses did not. This was signed in May. And then this is Dr. Tinker. I need to bring him here on this because they sat around the table to sign this.
He can tell us.